So, as I said, for those who weren't on the call yet, my name's Eric Goslin. I'm the Director of Operations for TeleHealth Solution, the post-acute division. I'll be doing your training today. Our training is really to show you all at the facility level providers how to use our systems. And I want to be clear, like we're going to show you two things. We're going to really show you, well, three things. We're going to show you a little bit about how it works for the nurses and how they submit a page. We'll just touch on that just so you understand kind of how it comes to you. We'll then show you how you use our web application, which is just a website, to answer that page, to document on that page. And then as a third thing, which is a little bit separate from the web application at the facility level, is using the telemedicine cart. And so we'll go over all that today. And so this first slide is I'm kind of just going through this presentation as like kind of questions that you might have. And so, first question as a provider might be, how am I paged through telehealth solution? And so at the facility level, the each facility has a generic login that they log in to do their page. And so you're going to see right here when you navigate to our website, which is just www.telehealthsolution.online. We'll make sure we share that in follow-up emails. It's also on a lot of the materials you'll receive from us. You're going to see this website when you log in. And so then with your username and password at the facility level, you're going to put that in. You log in at your facility, and then it's going to bring you to a dashboard. And on the dashboard, when you go to submit a page, you have the option to page a facility provider. And when you go to page that facility provider, they at the facility level will have access right here to do a drop down and say which provider do they want to page. And so each facility has been given, the way we started with Southern is we made sure everybody had at least the medical director for their facility. As of today, we kind of confirmed the bigger list we're going to be adding. And so all the facilities, we're going to be adding a lot of the attending providers and some of the providers who are seeing the majority of the patients in your building. So maybe if you're on the call today, your access hasn't come to you yet. It's going to be by probably end of day tomorrow, probably even by middle of the morning. I should have them all completed. I'm about a third the way through the list of adding people. So you're going to get an email, and we can show you that towards the end of the presentation what it looks like. But once you create your username and password, then the facility will have access to page you directly. And so what they would do is they would then select whichever provider they want to page. And so they select that provider. It then opens up into basically a short web form to do the page. The one thing I didn't really take a lot of time to show on this is there is a way that when they're filling out the page using a point click care integration, if they have the medical record number, which they should be able to have, they can have this box right below that will fill in the demographics for that page. So this red box will be auto-filled for the nurse as long as they're using the medical record number. Right above, I just want to point out that when they go to submit a page, what they're doing is they're putting the number they want to be called back on, because that's the first thing that will happen with a page is you'll just call the facility back. They're going to tell you what number to call, and if there's an extension, that all goes right here. That also makes it so that when you go to do a call back, if you're using your cell phone, it will auto dial that number. So they put in the phone number, they use the integration with point click care, it'll fill out the demographics. And then after that, they just have a simple, short clinical form. So they check the reason for the page. In this case, it'd be change in condition. When we say change in condition, we mean there's something that the patient needs to be seen because it's more urgent. This would be kind of on the lines of looking at preventing hospitalizations or patient worsening symptoms. But there's other reasons they could submit a page. They might want to your policy might be to inform you about lab results that you want to know about, or there's a follow-up that you've requested. And they could put all these reasons right here up for a page. There's also the ability to page for a new admission. So if you want to know and you want to do a telemedicine a new admission consult, these are all reasons they put in. So they simply check a box, and then they have a free text box where they can put the reason for the page. So some of the facilities, when we train them, said what they'll do is they'll just copy the S bar on why they're needing a provider to get involved, and they'll just paste it into that text box. They could also paste in abnormal lab results right here. So this is kind of their free text to you in the page, and it's right there in the page. It's one of the first things you see. After that, they can use these check boxes for symptoms. So chest pain, nausea, vomiting, blood in the stool. The nice thing with the check boxes, if you work with your facility and if you wanted to know like all the patients who had telemedicine that had chest pain, you can run reports and filter by these text boxes. I'm sorry, these check boxes. So once they've done that, maybe they save some typing by using the check boxes. Then if they want, they can upload a document or upload a picture. So maybe there's a wound they want to show you, or the patient had a fall and there's a skin lesion. They could take a picture on an iPad and on the iPad, do the page and upload that file right here. Once they click submit the physician request, it's going to bring them to a screen that says this page was successfully submitted. So they know that you have been sent that page if they paged you. At that point, they can go back to the dashboard, which is where they first log in, and it's going to show that the page was submitted, and they'll see when the page was submitted, who the nurse they're going to be calling back, and the patient's initials. And so they know that page is out there. So then the next question, well, so you've received the page, how do you answer that page? And so I'm going to pause every time I go through kind of a step in the process. Let me pause and see if there's any questions on any of the initial how the nurses page out or anything on that. Any questions? Okay. Again, as we go along, if there's any questions or thoughts or comments, please speak up. I'd happy to discuss and go over anything that's a concern or a question. So when the nurse hits that submit the page, the reason we require a cell phone for a provider is that it's going to send you a text message, and you get this text message, and within that text message is a link. And if you click on that link, it's going to take you to whatever browser you have as your preference. On an iPhone, we can get into why you might want to have Google Chrome be the browser that you use. But you click on that link, it's going to open up the website. You're going to have to log in the first time, but we recommend you save that on your phone because you're probably logging in with a passcode on your phone anyway, or your fingerprint ID or facial recognition. There is a password to get into our website, but it's behind the security of your phone. So when you click on the link, if you've got it set up, it should auto log you in, or you might have to put in your username and password. But once you get to the screen, it's going to show you the page on your phone. It'll go in a mobile ready format if you're using a phone or an iPad or another tablet. And you have a couple options. You can receive the page, you can call right back. If you hit receive page, it's going to let you know the patient's not called. And I'm going to show you better screenshots in a second. But if you hit call, it's going to then, you'll see right here, it auto dials that call. And so you just would hit the call at, and then hit the call button, and then you'll be talking to the nurse. You just ask for the nurse when you call. And at that point, you'll notice along the way of the page, the status is updated, and you don't have to actually update the status. It just happens as you're working through the process of the page. So let me take a step back, and I'm going to show you a little bit better screenshots on my computer. It looks just fine on your phone, but I think from a computer standpoint, I was just able to make cleaner screenshots for this presentation.
So Eric, I just want to ask for a physician who is not going to get a lot of calls on this. So they're going to get a username and password that they have to know the first time, right? Am I understanding that right?
Well, they're going to get probably to Mike Hanatry's funeral on Friday.
Sorry, you're going to get a username. They will set up their own password.
I'm going to go on to the Y.
Okay, all right.
And do we give before I leave, Jimmy?
Do we give that to them? Are you going to get that to them? How does that?
As soon as I put them into the system as a provider, they will get that notification email. And if they can't find it, and I asked Laura to send an email out to the providers today. They should check their spam or junk folder. And if they're really having problems with finding it, they can email support. They can email our support email, which is support@telehealthsolution.com. And our support people can help them figure that out. If they need a password reset, you'll see right here, even on this screen, it says forgot your password. We're going to have a couple slides at the end of the presentation on how they can reset their password. We can help them with password resets too. So either way, we can help. But it is self-service when it comes to password resets. So if they don't know their password, or if they just plain want to reset it because they want to change it, they can do that on their own. They do have to navigate to their email to do that though.
Okay. Perfect. Thank you.
So the same website, www.telehealthsolution.online. It's just now you're logging in with your facility provider login. And it's the same when you click on that link, what it's doing is it's taking you to our website and you're going to log in, but instead of having to navigate to the page, that link will take you right into the page. So you don't have to do any navigations. You can always go to your computer or desktop or whatever is most comfortable for you and log in, and you can navigate to the page, and we'll show you how to do that as well. But you're going to log in with your own credentials as a facility provider. When you first log in, You're going to see it's going to have you on facility manager. There's really not much for you to do. What you're going to want to do is either you're going to navigate to call request. But again, if you use your text link, it's not going to have you navigate. It's going to take you right to the page. So if you log in, you see this page, or if you want to, you only have access to what is for you. There's nothing that you can break in here. So you navigate to call request, and then you're going to see any calls that are open or pages that are open for you. So in this case, you can see I've got one page that's in progress. So I started, maybe I've called the facility. They're going to call me back. We're going to talk about something. There's something that I haven't finished my documentation. And then you see I have another page that says I have a page and it's not been started yet. And that's the one that, just for an example, that's what I just had been putting in for the nursing side. So page not started. So I have a couple options. I can, I'm sorry, right up here, you'll see little red indicators of how many active pages you have. And then even in the middle, you'll see how many follow-ups you have. You always know by the red indicator. And so this is your page. It gives you a general overview. And the first step typically would be you would receive the page just to let them know you're going to call back, and that updates in our system. And then again, it will change from, call not received to patient not called. At this point, you can either hit call. So you call them right back because you see the reason for the page, you see the clinical note from the nurse, and you kind of know the patient, you know what's going on. You don't need to go into the call details or go into point-click care. You just want to talk to the nurse about, what's going on. You can hit the call button, or you can dial on your phone and then hit mark as called at that point, or you can hit call details. It's really up to you. You guys will kind of figure out what works best for you. When you hit call details, what it does is it shifts the screen, and it goes from call progress. So the status has been updated. It's saying
out there in case Abby needs to know.
And then when you hit the call details, it brings you into this screen where it expands out on what you've seen. And if you scroll down, you're going to be able to see more information. But right at the top, there is a link, and you can navigate into point-click care if you want. And that link will take it right to the patient's chart. As long as the nurse page with the point-click care integration, it will look the patient up for you. You click on that link. It's just you may have to log into point-click care depending on how you set up your computer. And the other thing is, let's say you have the nurse on the phone and they have a question about another patient. You do have the option to search for a new patient in point-click care if you need to look something up. Or if for some reason the medical record number was inputted wrong or there's some mistake, you can change the patient down here. So there's a couple ways to get into point-click care. So you don't have to hop out of our system to go into point-click care. It's kind of all linked to point-click care right in our system. And this is actually something we're going to be expanding on more and more. In fact, down the road, one of the thoughts is we will actually be integrated within point-click care is the hope. So if you scroll down, you're going to see right here, it'll show you the clinical notes from the nurse again, but it also will show you any facility notes. So what we typically put in there is if there's any iSNPs, and we put in if there's a service contract, if there's anything that needs to be a nuance to the facility that we need to know about. But if there's ever something that needs to be put in there, we can change facility notes if a provider asks us to. That's something we can do. So quick point out right here at the top, it says call details. That's where we're on. Let's say they uploaded lab results or a picture for a wound. You're going to navigate to attachments, and you'll see any attachments listed off here. And you'll also, if there's an attachment, you're going to see a red indicator saying there's an attachment, right? In this example that I had, I didn't have an attachment. One of these days I'll get a picture with an attachment, but they would be just right here, and you just click on that little indicator. Let's say you reviewed the page, you've reviewed the attachments, or there are no attachments. At this point, you're going to navigate right to the middle, the diagnosis and exam. And this is where you're going to document. So the very top of the page doesn't change. What it does is it changes the bottom. So you still have access to the patient information, point-click care, the reason for the page. But now what it's doing is it's allowing you to add a progress note, and it's allowing you to update an outcome. And so a couple things I want to point out is, I got to fix that. Yeah, let me see. There you go. The red box is what I'm talking about. We are going to be adding, per Dr. Gonzalez and Southern's leadership's discussion, we're going to be adding a SOAP note format. So it'll give you a template. So it won't just be a free text box. We're going to add something that's a little bit more beefy and a little bit more helpful for the providers, especially if you're not at a desktop or laptop and you're documenting on your phone. I don't have a date for when that's coming, but it is coming here somewhat soon. And that will just add to the functionality that you have. Either way, you can free text in, or when we have the SOAP note, you'll have a little bit of a template you can use if you want. And so Once you've documented your progress note, then you have to decide on what the outcome of that page is. And so we're going to go through that now. But before we go through the outcomes, let me pause and say, any questions on any of what we've covered so far? Anything I should go back and review again? Any thoughts?
Do you have, Mark, just asking, I'm sorry to ask other questions, but do you guys have any like cheat notes for a physician who might get like a page every 3-4 weeks who's not going to be all up on, you know what I mean?
We do have a physician manual. It's not
Manual? All right.
Yep, it's only a couple pages. It does have all this information. I've shared that with Laura. I think she said she put that somewhere, but I can get that to you, Gerard, and I can make sure Laura gets that out there so that people know that the slide deck is available if you want to review the slides, and then the manual is available, which gets into the details on a lot of this as well.
Okay, I can look for it. If Laura sent it, I haven't seen it, but what I have in my head and what she might have sent, I didn't realize that's what it was. So that's fine.
That's okay. And if you can't find it, let me know and I'll get it to you.
Thank you.
Yeah. Any other questions?
Is there any way to dictate into the note?
It depends on what you have. I see Dr. Hubert is on the line, our Chief Medical Officer. The answer is yes, you can dictate in it. Like if you're on an iPhone and you have dictation, or an Android device, you have dictation, or your desktop and you have dictation, you can dictate right into the note. So Dr. Hubert, could you add to that if there's anything I'm missing there? But am I correct? If Dr. Hubert's there,
Sorry, I was on mute. Yes, you are correct. You can dictate. If you have a dictation system on your computer at home, you can use that as well.
And the other thing, great question, by the way, and thank you. The other thing to point out is you can, if you had a Word document where there was one provider at Southern that said they had a Word document with different templates they like to use, you can cut and paste into this free text box. And when we add the functionality of the SOAP note, it will not take away any functionality on dictation or being able to cut and paste. What it's going to do, it's going to allow you to type into different fields, and then you can hit a button and it will pull it into a full progress note that can be uploaded to Point Click Care. It will still have a free text box if you prefer to just do dictation and free text. You'll have the option to do either. So when we add that functionality, it won't take away the free text ability as well. So outcomes. So when it comes to outcomes, we are going to be working on a cheat sheet, if you will, just so it's clear, but we're going to run through them today as well. And, feedback is always welcome. I think one of the things with the grant is these are the outcomes they're looking at. And so as we get going with Southern and we've worked out the operational kinks, if you will, and gotten equipment in place, now we can start focusing on some of the clinical discussions and some of the outcome discussions. And so I'm looking forward to that. So where we're starting off today, though, here's kind of what we've gotten from Southern as far as outcomes and kind of what we've been doing at TeleHealth Solution. So right here, you'll see that one of the outcomes of a page is 100% complete. And then you have to choose, did you prevent an inpatient hospitalization or did you prevent an outpatient encounter? And so an inpatient hospitalization is exactly that. You're saying, if I wouldn't have gotten involved, this patient was probably going to go to the ER and be admitted, but I prevented that. Or, as a team with the nurses, we prevented that, however you want to view it, but it's prevention of a rehospitalization. Prevented an unnecessary outpatient encounter might be something like it prevented somebody having to come in to see the patient, or for the patient having to go to an outpatient appointment. You prevented that extra level of care, or that extra clinical intervention by getting involved earlier and getting a plan in place. So you have to decide between one or the other, but you're saying the patient after your intervention is all set, it's 100% complete. So that's the 100% complete outcome, and you have to choose between the two. Sent to ER. So patients are going to go to the ER, obviously. There is a free text box when they go to the ER, and that allows you to, as we put here, put in helpful info on why the patient went to the ER, or maybe some transfer details. So you can add a piece of the hospital ER note. It helps us, we keep that recorded. It helps people see what the reason for the ER transfer was. But when you do the ER sent to ER outcome, what you have to decide on the initial page is the patient going to potentially come back? And so if they're not going to come back, you're going to check this box right down below and say no return possible. So they're going to the ER and they're going to be admitted from what your clinical evaluation says. If you don't check the box, what it's saying is there's a potential they could come back, and it's going to put that patient into a follow-up status. So on the telehealth solution side, we have clinical care nurses that will follow up with those patients at the ER, or providers will follow up. And so what they try to do is to see if there's a way to get the patient back safely to the facility before they're admitted while they're still under observation status. On the grant side with Southern, what that will do is it's going to put it in follow-up status. And if it's your page, it's going to be in your page portal to follow up on. And we'll go through kind of what that looks like now. And so when you don't check the box, right here at the top, you're going to see follow-ups, and you're going to see a little red circle indicator on how many follow-ups you have that are active. So when you click on that, now you're going to see something that looks almost exactly like a page, a new page, or a page in progress, except for the top bar says patient ER follow-up needed. You have the same option to call the facility or to click into call details and document. And so when you want, if you call the facility and they say 3 hours later, yeah, the patient returned, they went out, we got them tested for pneumonia, and they came back, with new orders, or you helped bring that patient back and they have new orders, or you gave new orders, you would then just click call details. And now what you could say is you can either check two boxes. You have two boxes to check. One is the patient went to the ER, it's been a couple hours, we followed up, they're not coming home. You can check no return possible. If they did return, you can check patient returned, and that becomes a different outcome. And so the outcome is they went to the ER, but they were safely brought back. And if you put no return possible, it's a sent to the ER outcome, and it's considered a hospitalization. So the little nuance when it comes to follow-ups, just to allow you as a provider to be able to follow up and not have to select a solid outcome right at the beginning of a page, because sometimes you don't know yet. The one thing about follow-ups are they do time out after 24 hours. So if you have a follow-up, it's 8 o'clock at night and nothing is done and it's been 24 hours, that patient sent to ER will switch from a follow-up status. It'll just drop to the patient sent to ER status with no return possible. And that's just an automatic, so it doesn't stay on the radar too long or stay in there and jumble up the data. But there is a 24-hour cap on the follow-up piece. So patient deceased, that would be if the patient passed away, and is either during your intervention, or the facility is notifying you. If you wanted to be notified of patient death via our system, you can use that as an outcome. That does complete the encounter and drops the page off the system. And then finally, let's say you called the facility at the number that they provided, and maybe you even know the main line, and you called and asked the receptionist to try to reach somebody, and you just couldn't get through to anybody at the facility to help with that patient. You do have the ability to do a called could not reach facility status. And what that does is, on the facility side, it puts it back to them. And if they want to be paged again, or if they still have a reason for you to call them back, they can hit redistribute that page, and it will put it back into the paging system as a new page. But you at least get to say you attempted to make a call to return the page, and now you can hit click that outcome, hit update encounter, and it will turf it back to the facility, and they have to then say whether they want to be paged again or not, or I should say whether they want to be called again. So if any of the outcomes we've put in are completed outcomes that don't turn it into follow-ups, which really the only one that I'm aware of is if you say they went to the ER and you're not sure if they're returning or not. At that point, under call requests, right here under recent, you'll see is status from the page changes from patient in progress or not called. It's going to turn into patient, the page has been completed. And then I've got my fun little slide that says once you've kind of answered the pages on deck with the little red circles, your work is done. You can relax. There's nothing more for you to do. So it's pretty easy to see when you don't see any red circles at the top, there's nothing for you to do in our system as far as answering pages. So let me again pause. We've kind of gone through the paging process. We're going to talk about the virtual cart next, but any questions on any of the paging piece or the outcomes? Dr. Hubert, is there anything you would add?
No, not at this time. You got it.
Was somebody about to say something? I'm sorry.
I just said I didn't have any questions.
Okay. Okay, so virtual visits. So, the virtual visits is where you're going to be able to use our telemedicine cart. You can use it from any device with one little asterisk. There is a limitation on iPads and iPhones when it comes to using the Safari web browser. We cannot, the video component of our cart at this time doesn't work with Safari on iPads and iPhones. It will work on a MacBook, but it won't work on an iPad or an iPhone. The solution to that, and one of these days I'm going to try to create a manual or some tips on how to get this going, but you can use Google Chrome on your iPhone or iPad. So you download the Google Chrome app web browser, and if you log into our web application using that, then you can do the virtual cart using your phone or your iPad. So it's not a total block, but there's just a little bit extra work to get it to work. And so let's say you call the facility, you talk to the nurse, you want to see the patient because you want to talk. Dr. Hubert, I want to kind of give me the example you gave the other day when sometimes you talk to the nurse and sometimes they will say the patient's not doing well, but then you talk to them and they seem fine. What was that example? Do you mind sharing? Oh, I keep putting her on the spot and she's probably got a lot going on. But if we get her back, I'll have her bring it up. But sometimes it's worth you just taking a minute to talk with the patient. And so to do that, all you need to do is when you're in the call details. So I'm in the page, you'll see the 3 different options: call details, diagnosis, exam, attachments. But right here, there's a little toggle. And you'll see it on either call details or diagnosis exam. You're going to see this. So when you toggle it on, you'll see it turn purple. And right here, a pop-up came up. And what it's saying is that you or the nurse has gotten verbal consent for a telehealth visit. And so you just want to make sure people are asking permission before they put the patient on. But most of the time, that's just kind of part of the discussion when they're going to do a virtual consult. So then you as a provider have to say, yes, the verbal consent has been received. And so when you hit that button and then you hit continue, now you'll see the toggle stays on, but nothing changed. But what it's done is it's activated this telemedicine portal button. So when you click on that button, it's going to bring you into what we call Agnes or our virtual room. And I'm going to show you a couple slides just because the first time you use it, you have to do some setup. And so the first time you use it, you're going to have to say what organization you're logging into. And so right here, you're just going to have to type in the first time telehealth-solution, all lowercase, and then you hit go. Once you've done it once on that computer, it will remember it unless you clear out your cookies or you go to a different browser, but it should remember it. And then when you hit go, it's going to ask you to log in. And we try to keep it very simple. Your username is your password, and your email, which is what you use to log into our system, is your username and password for Agnes. There's no patient information in this system. It's strictly just a virtual consult room. We're not pulling anything from PCC or anything like that. So we make it simple. Whatever your email is, just put it in as the username, and then you put it again as your password. It should work. You hit submit. Then you're only going to see facilities you have access to. So you're going to see Southern Healthcare. You click on that, and then any facilities that you're assigned to. So if you're over Pinellas Point and also over Boynton Beach, you'll see those 2, but nothing else. And so you should only see facilities that you're assigned to. So this looks a little bit busier than you'll see. You may only see one facility. And you'll see right here, if I wanted to do a session with Bay Shore, I would just click on this button right here, start session. And I'm logged into Bay Shore's cart. If it asks you to continue, which it doesn't always, I think it does it to confirm it, you're already logged in. You're just going to hit continue as yourself. And now you're in what we call our virtual room. Their virtual room looks the same as yours. So everything that you're seeing, they see the same thing. And what I like to point out is right here in the bottom left, you'll see active users is 1. When you see active users go from 1 to 2, you know they're in the room as well because you're 1, and then when they log in, they're 2. And so once you log in, you can set it up. Your video should be on automatic. You can switch on the video, switch it off. And so I want to just point out a couple of things with the arrows. So you can, right here, you see the video toggle. You can toggle your video on and off. You can mute yourself. I'm sorry, I think mute is actually muting yourself. So they can't hear you. And then microphone is you're muting them. So maybe you need to mute them for a second while you get on a phone call, or you need to mute yourself. You can do that, either one here. And then self-view, you'll see I was working at a Panera, and here I am. I hit self-view as I'm in a session, and it'll show you what your camera is showing. So if you want to see what your camera, what the patient is seeing, you can hit self-view and it'll show you that. You can also, again, turn the video off by toggling it, and then they can't see you. And so there's a lot of, I should say, you have a lot of control over how the virtual consult goes, and if you need to pause for a second. So as we kind of go through the left here, there's a bunch of buttons, and I just want to kind of go through each. The way this works in the virtual room is really the same as a phone call. When you're ready to call the cart and you see 2 active users, you just hit this call button, and they're going to accept a call just like a phone call. So once you're in the room, now you have a couple options on the left here to use. So documents, this is where if your facility is one of the 5 facilities at Southern that receive an EKG or an ECG, you would find the recordings of the ECG in here. So you're really going to use this for the most part if you have an ECG. The next would be vitals. All the Southern carts either came with pulse oximeters, or this week we had a technical engineer installing them. So all the carts should have a pulse oximeter by end of week. You just ask the nurse to put on the pulse ox. It will automatically start working. And so all they have to do is navigate to vitals, or I should say you have to navigate to vitals, and you'll see the pulse and you'll see the SpO2 appear right here on the screen. So there's nothing for the nurse to do and nothing extra for you to do. It'll start working. You go to vitals, it's right there. If you want, let's say you want to use the stethoscope, all you're going to do is click on the stethoscope here. It'll pop up. You'll see the person. You're going to click on the green button for no audio. And then you just select stethoscope. And what you're saying is, I'm turning on the stethoscope. Our recommendation is that when you turn on the stethoscope, the nurse already has it on the patient. So if you're going to listen to heart or lung sounds, go ahead and have them put it on the patient. Then you turn it on. So and you can instruct them what you want to do from there. But the stethoscope itself is very sensitive, so it's going to pick up wind. If it brushes a shirt, it's going to be very loud, I should say, unless you're using it as a stethoscope, because it is sensitive. When you're done, you just switch it back to no audio, and it turns the stethoscope off, and you can turn it on or off throughout the session. For the ECG piece, we're going to do a separate training, but it is as simple as, basically, if your facility has the ECG, they would put the leads and the electrodes on the patient, and then you as the facility, the provider side would hit launch ECG, and it would start the reading. And any recordings, again, would go up into documents. And then finally, the notes section. So this is a handy section. Dr. Huber shared a kind of a tip, and I added it to the PowerPoint. This would be a great section. So let's say on the right hand here, you're talking to the patient and the nurse face to face. You've listened on your stethoscope, and you want to start writing your progress note while you're talking to the patient. You can navigate to the note screen and then start typing in the free text here. And then when you're done, you can copy and paste that into the progress note of the page. So you don't have to necessarily keep flipping back and forth between 2. If, let's say, you're on one monitor and not on a dual screen, you would just go to notes and just start typing here, and you could do that. And then again, just navigate to the web application, paste in your progress note, select your outcome, you hit update encounter, that flows right into PCC as a progress note. So we're going to get into just a couple tips and tricks next, but I want to pause and just say, are there any questions in the virtual cart piece? Okay, so what if I forget or I don't know my password? We try to make this simple. You're simply going to navigate to our website, any web application except for Internet Explorer. You type in www.telehealthsolution.online. It's going to show you the screen, and then you just click on the forgot password link. As long as you've been set up in the system, even if you've never logged in before, your email will be active with us. You're going to put in your email, and then you push reset, and then it's going to say you've been sent a password reset email. You're more than likely going to need to check your spam folder if you've never received an email for us. But you should see the email that looks like this: notifications@telehealthsolution.online. I would recommend you safe list that on your computer, because that's also how you receive summary reports. But you're going to get this email. You click on the password reset link. You then will come to this screen where it allows you to reset your password. It gives you the password parameters, it's got to be at least 8 characters, the max of 50, 1 uppercase, 1 lowercase, 1 number, and then a special character. If you make a password that matches that, you type it in, then you confirm it, and then you should be all set to log in with a new password. You don't have to wait for us to get back to you on support if you want to reset your password or you have forgotten it. So what if I'm called outside of the web application, but I want to use the virtual encounter piece, or I want to document on this page, to get, credit on the grant, or, just in general to use our system. So you can do that. You can create your own page and then answer your own page. So when you log into the system, you're going to, right here on the left, you're just going to click on new call request, and then it brings you into a real abbreviated form. And so you put in the number that the nurse wants you to call them back on. So this isn't your number, this is their number. You're going to put in the nurse name that you talked to. Oops, I'm sorry. I put facility provider. That's actually a mistake. It should be the nurse team member. Patient first name, last name, any information you want to add about that. You have 2 free text boxes here, and then you hit submit patient request, or sorry, submit physician request, and that's going to create a page under your call request that you can then document on. So maybe you get a call and you want to use the telemedicine cart. You could create a new page and then call them through the paging right off the bat. You don't need to call them again. You could literally just toggle the button on and do a virtual consult that way. How do I see my metrics, or how will I know if my patients are seen by telehealth solution? So if your facility is contracted with us, or if you have interest and want to see kind of what's going on at the facilities you're working in, or just specifically your paging, we do have what we call live metrics. So it is live. As pages go into the system and as things happen, it'll change. And so when you click on live metrics here, you can then decide a couple things. Right at the top left-hand corner, it'll say, well, how far back do you want to go? You can do last 24 hours, last 3 days, last 7 days, or last 30 days. When you click on that, the graphics will change. And so right here, you'll see this is call volume. And this is literally just telling you when the page comes in during the day. So if you're curious to know if any page came in overnight, you could leave it on 24 hours, check the live metrics. You'll see right there, a page came in at 3 a.m. In this case, you can see a page came in at 5, and it's right there. The next would be active outcomes. So let's say you see a couple pages and you want to know what happened because you weren't involved in them. You can see what the outcomes are here. In this case, you have half the pages, which I think is just 1 page, is in progress. So the physician hasn't finished their page on the outcome piece. And the other page was they would treat it in place with a video consult. So down below, this is getting into the actual details of the page. So you're going to see the date of the page, the facility, which is going to be whatever facilities you have access to, patient name, which you can hide with a little toggle at the top. The provider name is who answered the page. PCP is whoever that patient's PCP is. The reason for the page would be the nurse reason, and then the outcome. And so you can see right here, there's 1 in progress page and 1 treated in place, and that's that active outcomes up top. And if you want to see what the progress note was that the provider inputted, you just click on the little blue button and it'll pull up the provider note and you can see what they wrote. So you can see what happened with your patient. The alternative is you can still see it under the patient's chart. So if in point click care, you want to look at the patient's chart, you'll see our notes. They flow into point click care, as well as any providers that are using our systems. Whenever they hit the update encounter button, it completes the page. So on a completed page status, that note goes right into point click care. And depending on the documentation, should be billable as well. Finally, I just want to point out that you are, as providers, set up to be report users. You can do full reports. I won't be training on reports today. If you do want to learn more about that, I'm happy to do trainings or show somebody. But you will receive an email, and you can select to receive the email once a day, weekly, or monthly. So daily, weekly, and monthly. And this is what it looks like. It'll say how many pages were received, how many were virtual encounters, and how many were ER visits. And if you want to know more, you click on the link, you log in, you can either pull reports or go to live metrics. So daily, weekly, or monthly. And then finally, live metrics. I won't get into too much, but there are 3 different reports. They're pretty easy to run if you want to play with them. Roll up is just data reports, so it gives you numbers. Custom reports is exactly that. You can choose the data you want to pull, or you can deselect it and you can save reports. And then finally, encounter is for whatever time frame and whatever parameters you put in, it's going to pull the patient information for those pages. So we've gone through a lot today. I always like to just pull back and say the system seems bigger than it is when you're training it because we give you a lot of the details. But once you've done a couple pages, and I think as we get that cheat sheet on outcomes published, it's going to be a lot easier than it seems. And definitely the first time you go to log in, just like any new technology, setting up a new phone or a computer, there might be a couple things you have to do that you're not normally going to have to do to answer a page. We do have a support email, support@telehealthsolution.com, and we will respond to you and we will help you. We've been doing it since go live, and I would encourage you, to use it and get your barriers and your questions answered. And if at a larger kind of bigger level of planning, you have concerns, work with myself and Laura Quinn at Southern, and we can work on that as well. I do think we're starting to get the facilities in better shape as far as getting the carts all ready. And I think hopefully by tomorrow, by noon, I'll have a lot of new providers added to the system, which I know will help for facilities to be able to use our service more. But that's what I have today. So I'm going to pause again for any questions, any thoughts, and then we can wrap up. All right. Well, I'm going to go ahead and stop the recording.